It's 8:30 now here on this Thursday. We've got Dr. April Ritz in from Effingham Pelvic Health and Wellness joining us on the show this morning. Good morning.
Good morning.
How's it going today?
Doing great.
Glad to have you here.
Thank you guys.
Yeah.
And a very busy Dr. April.
Yes,
Yeah.
we are booking out and we are hiring. So if you know a physical therapist that wants to join our team, and I'll share later, we're also hiring a front desk. So yes,
Okay.
we are busy and growing.
Yeah. So now I guess we'll start off some myths about pelvic physical therapy. Tell us a little bit about it.
Yeah, so I have like 9 myths or kind of surprising facts that most people don't really know. So number 1 is that our clinic does not just work with women after having babies. Everybody thinks that, pelvic floor rehab is just for those who've had babies, and that is not true. It's probably our biggest misconception. We do treat a lot of pregnant and postpartum women and women who've had babies in the past, but we also treat men and kids as well. So men after prostate surgery, chronic pelvic pain, kids with constipation, smearing, bedwetting, urgency, leakage. And we also treat athletes as well with hip, low back, SI, hip pain. People don't really realize this, but athletes often have a high level of pelvic floor dysfunction and like overactivity and tension in those muscles.
I see.
Yeah,
Okay.
I got to admit, I was guilty of that too, thinking, oh, that's pretty much what they take care of is women and dealing with pregnancy and that sort of thing. But I've learned over the year or so that you've been doing this, maybe longer, that there's a lot more to it.
There is.
And the fact that you have that much more skill beyond that care.
Yeah, so like when I first started, it was like actually about 10 years ago, and then even in grad school, I did pelvic health too. I did clinicals and I did an independent study in pelvic health. I knew this is what I wanted to do and specialize in. At that time, when people start in pelvic health, they typically just kind of dabble in it, and they know the basic, urinary leakage for women, and that's about it. And that's all like the first classes. So I always tell people our clinic is the only 100% specialty clinic within 86 miles of Effingham that solely specializes like in abdominal, pelvic, hip, low back issues, and that's our passion.
Yeah.
I like it that you deal with the stuff, and I guess this is any medical professional. You deal with stuff that's sometimes uncomfortable for us out in the public.
Oh, for sure. I have patients all the time that say, so how did you get into this? Like some of the stuff we're doing internal exams on patients. And to me, it's just what we do. We know what we're doing. We're comfortable with it. We're good at it. But to patients, they're like, why did you choose this profession? And it's like to help you because there's not very many people doing this and people need the help. So
Yeah, exactly. Speaking of that, let's talk leakage.
yes. So a lot of people have the understanding, and they think that they know that leaking urine is completely normal after you have babies or as you age. And I even have some patients who come in and say, oh yeah, I do leak urine and they're pregnant, but my OB told me that is normal. It is never normal to leak urine unless you are within the first 6 weeks postpartum of having a baby. It is common to have some leakage then as those muscles are rehabbing. And then too, after prostate surgery, some men in this first few weeks may have leakage. But after that, after the 6 weeks, we should not have any leakage. So I always tell people, like, if you leak with sneezing or coughing or jumping and you think it's just part of your life and it's something you have to live with, that is not the case. It's very common, but it is not normal and it's treatable.
Very
So
good.
that commercial I'm seeing on TV where there's a person and that second person's daughter sitting there and they're talking about whatever and I peed or
Yes. People laugh about it, and I'm like, okay, sure, you can laugh about it if you want, but that is actually a problem, and you don't have to deal with it. You don't have to just put pads on and live with it. So.
Yeah.
All right.
Very good. Of course, the opposite of leakage is constipation.
Yeah, backed up.
Yeah, exactly.
So we do treat urinary leakage and bowel leakage, but then the opposite of the bowel leakage would be constipation. So we see a lot of patients with constipation, and people don't realize a lot of other pelvic floor issues such as leakage or pelvic pain stem from constipation. So constipation isn't always just like a poor fiber intake or poor water intake problem.
Mm-hmm.
Up to 50% of people with chronic constipation have this condition called dysenergic defecation, meaning their pelvic floor muscles. So if we think about our sphincter, it is supposed to contract to hold things in, and it's also supposed to relax and open when we're having a bowel movement.
Mm-hmm.
For some people, up to 50%, this muscle is not working right. So instead of wanting to open and relax, it starts to hold tight all the time, and it's not coordinating like it's supposed to with bowel movements, causing even more issues. So if you're constipated and you've tried the fiber and you've tried the water and you've tried laxatives and you're tired of having to live with those, our clinic does treat a lot of people with underlying constipation issues, and we can get those addressed.
Very good. Very good. So pelvic rehab can make pregnancy, labor, and postpartum recovery easier?
Yes. So everybody thinks awareness of pelvic rehab is a lot more popular now. So people think after having a baby, I probably should be doing this. But research even shows now that pregnancy prep is just as important. So working with women, we start in the second trimester, and research is showing that if you do pregnancy prep, even if you're asymptomatic and feeling good, you don't have sciatica, you don't have pelvic heaviness, you're feeling good. If you do labor and delivery prep, and our clinic offers all of that, it reduces your rate of episiotomies, fewer high-grade perineal tears, less like vacuum and forceps delivery. Your perineum pelvic floor stays intact better. And also it shows improved sexual function postpartum, early return to intercourse with less problems, and less issues with stress urinary incontinence, which is that leakage with coughing, sneezing, laughing. And this is compared to women who only start postpartum.
Yeah.
So we really recommend women starting during pregnancy. And I'm going to tell you, we are busy right now. So if you are pregnant and due this fall or even early 2027, give us a call. And we like to get started in second trimester with moms.
Okay. Very good.
So not to oversimplify it, but it goes back to an ounce of prevention worth a pound of cure type of thing there for them?
For sure. And if you know how to engage those muscles, it's just like a total knee replacement. Often you're doing prehab before knee surgery now to learn how to engage those muscles and use them. And when it comes to labor and delivery prep, you need to be able to coordinate with those muscles. And a lot of women have no idea how to coordinate their breath with their core, with their pelvic floor. And we always say birth is like an athletic event. It's the biggest physiologic change a woman will go through.
Sure.
So preparing your body is very important.
Yeah, breathing's so important. I know when we were out west just a couple of weeks ago, they said as far as with the high altitude, thinner air, breathe through your nose and out through your mouth.
Yeah.
And it's amazing how much that little thing helps.
Yeah, and it's not just for pelvic floor. Like I had a patient this week who has some low back pain, and if she has a flare, she does her 4-6 breathing, and she's been trying to get her son who has some anxiety issues. This also helps all areas of life, all people, not even if you're dealing with pelvic floor.
How about low back, hip, and SI joint pain?
Yeah, so most people don't realize that that is connected to your pelvic floor. So
Wow,
our pelvic floor muscles come back and connect into our tailbone, and then there's ligaments also that connect to the sacrum.
Okay.
And all of that is supportive tissue for our low back. So we see a lot of people with low back pain, also like left or right sided low back pain, which is typically SI. And we help with like corrections of that and alignment. But then we get to like the underlying root cause, which is often a muscle dysfunction and imbalance left versus right. And so we work left, right, tightness, flexibility, strength, but then we also are looking at those pelvic floor muscles because they stabilize that joint as well.
Okay.
So 90% of women with low back pain have pelvic floor dysfunction.
Wow. Okay.
Yeah.
And of course, pelvic rehab, there's some misconceptions about that, I guess.
Yes. So everybody thinks all we do, they're like, I've had people say, I had a patient come in and her friend who drove by our clinic said, I don't know how they stay open. Is all they do Kegels? No. Okay. So we do some pelvic floor strengthening, but it's a lot more than that. So we're doing a lot of relaxation, breath work, coordination of your core, your pelvic floor, core strengthening, hip strengthening, mobility, honestly, giving people Kegels can make symptoms worse.
Okay.
So we do not tell people just to do Kegels.
Yeah. Yeah. There's more to it than
Yeah,
that.
yeah, we have a
lot
doctorate
more.
for a reason, not just to tell you to sit there and squeeze your pelvic floor.
Oh, now let's talk about pain with intimacy.
Yes. So I've had multiple people who just think pain with sexual function is something they just have to live with, or they've had it their entire life and they don't know any different.
Mm-hmm.
So it's not the way it has to be after having babies. Some people start to have this issue after having babies and like perennial tears. Some people think it's just because they're getting older now that they have to deal with this. Also, we treat men with sexual dysfunction as well. So people often just blame it on age, like I'm getting older. But muscle training, working on those muscles for women and men can help. So we work on muscle tension, scar tissue, hormone-related changes, nervous system sensitivity. We have a lot of patients who've had a history of past trauma. So all that stuff is within our scope, and we can help people in the realm of intimacy becoming pain-free.
Very good.
And going back to what Greg said, you've heard it all before. So don't be ashamed. Don't be shy about coming in and chatting about whatever might be going on, right?
Yeah.
Nothing is TMI for us.
Yeah.
We want to know it all.
Yeah. Yeah. And so don't wait, right?
You got it. So people often wait years because they don't realize there's help. We always say the sooner the problem starts, the better it is to address it because you're going to get better faster.
Mm-hmm.
But even if you've been dealing with issues 20 years, 30 years, 40 years, even for some, it's never too late to address it. And we can always rehab muscles. Muscles improve. We give it 6 to 8 weeks. We can see improvement in muscle strength. But the longer it's been going on for some of our patients, we tell them, you're going to be working with us. It's not going to be a short-term fix. It's not like taking a pill. You're not going to be better immediately in 2 months. You should notice improvements, but it can take up to a year for people to improve and fully get the recovery that they need. So we're not a typical physical therapy clinic that discharges you within 6 to 8 to 12 weeks because we know recovery often takes a lot longer than that, especially for chronic issues. So we're not telling people, you're doing 75% better. Okay, because of insurance, you're out the door, you're done. We don't work that way. We want people to get 100% full resolution so their symptoms don't come back down the road.
And on the front end of this is why we fill out those questionnaires with 132,000 questions about whatever, blah, 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 because that helps you diagnose what's going on with us.
Yes, because if somebody's hesitant to tell us a part of their story, that could be vital information for us. And so we've had patients who have not told us things, and like a month or two in, we realized we learned something new, and we're like, this would have been super helpful to know from the beginning. So we do have an intake form. It is not quite that long, but we do look at it before patients come in because it really helps us tie the whole story together and make sure we're not missing pieces. So even women that had children 20, 30 years ago, we are asking about their childbirth. Did you have tearing? Like all those questions are super important.
Very good. And finally, period pain.
Yes. So the last thing is that people think period pain is normal. Okay. A low level pain is, but you should be able to function with it. So we actually have our mom and daughter period class coming up. It is on Wednesday, July 15th. And this is for moms with daughters between 8 to even 18. Moms leave this class. It's 2 hours full of information on menstrual health that they don't even typically know all this information. $25 per family. And we go over all the things of what's normal, what's not normal, what to do about symptoms. It's a very informative class. So yes, period pain that stops you from going to school or to work or having to miss events is not normal. And pelvic floor physical therapy can help with it. So we're actually one of the first line treatments for serious period pain and trying to get to the root cause of what's causing it and not just covering it up with birth control.
Very good. Now, how do we register for this class?
Yes, you can call our office to register, or you can go to our Facebook page, our website. All the links are there. But our phone number is 217-705-5077, and Corrine, our front desk, can get you registered.
Very good. Well, Dr. April, always a pleasure to have you here. We always learn so much from you when you come in. So
yeah, I appreciate it. I want to share one last thing before I head off
Sure.
air, before I wrap up, is we are hiring a patient care coordinator to start with us this July. So like this month, ideally.
Sure.
So if you are social, organized, good with technology, we would love to have you reach out to me. Honestly, I would love to talk to you today or tomorrow. This is a full-time position until mid-October, and then it would turn into a permanent part-time position Monday through Thursday afternoons. So if you're interested, or you know somebody that's looking for a job that would be a good fit for our clinic, please have them reach out to our office. We have this information shared on our Facebook page as well. Just send me a resume and cover letter, and I'd love to talk to you.
Very good. Very good. We'll come back and see us again real soon, okay?
We will. Thank you.
Very good, Dr. April Ritz. And be sure to stop by and find out